third paper-based documentation system is charting by exception, in that all methods are comes into two categories. First one is documentation by inclusion. Second one is documentation by exception. Documentation by inclusion means we should document all the informations. Then documentation by exception means charting by exception is a documentation system to record only the abnormal or significant findings or limitations. Document only the abnormal or significant findings or limitations. This type of charting prevents nursing errors, reduces repetition of documentation, saves time, and provides immediate identification of substantial changes in the client condition. This is about the charting by exception. Then fourth one is graphic sheets and flow sheets. Graphic and flow sheets are suitable methods of drawing of relevant information about the patient. Graphic sheets and flow sheets are suitable methods of drawing the relevant information about the patient. It is this reflect who performs the assessment or intervention. We can also find this who will perform this assessment or intervention. Flow sheet or visual sheet must be reflect who performs the assessment or intervention. We can find out who performs the assessment or intervention. The next one is variance charting. Variance charting, this involves documenting unexpected events, causes of events, actions, discharge planning, and response. Variance charting means documenting unexpected events, causes of events, actions, discharge planning, and responses. These are the 5 types of paper-based documentation system. Next we will see the computerized documentation. There are 2 types. First one is paper-based documentation system, then computerized documentation. Computerized documentation first is the electronic medical records. What is electronic medical records? An electronic medical record is a medical record in digital format created in hospitals. Electronic medical records are medical records made by the digital format. This facilitates access to patients' data by nurses at any given location. This method, electronic medical method, this facilitates access to patients' data by nurses at any given location, making automated check for drug and allergic reactions, clinic notes, and laboratory reports. The nurses can access to any location. Electronic medical record is a medical record in digital format created in the hospitals. This facilitates access to patients' data by nurses at any given location, making automated check for drug, allergic interactions, clinical notes, and laboratory reports. Then definition of electronic medical record. Electronic medical record can be defined as the legal patient record system in hospitals. All record systems are legal record. Legal patients record system in hospitals and ambulatory environments, in hospital and ambulatory environments, that is data source for electronic health records. Electronic medical record can be defined as the legal patient record system in hospitals and ambulatory environments, that is the data source for electronic health records. Next we will see the types of electronic records, that is computerized based patient record. Types of electronic health records, that computer based patient record. Under that, computer based patient record is divided into different records. It is electronic patient record, computerized patient record, electronic health care record, personal health record, computerized health record, digital medical record, clinical data repository, electronic client record, virtual electronic health record, population health records. What is computer based patient record? Computer based patient record is the clinical information system. It is a clinical information system to collect, store, manipulate and make available clinical information relevant to the care of the patient. The computer based patient record is a clinical information system to collect, store, manipulate and make available clinical information relevant to the care of the patient. First one is electronic patient record. This electronic patient record, it contains all or most of the patient's clinical information. Electronic patient record contains all or most of the patient's clinical information. Then second one is computerized patient record. Computerized patient record contains all or most of the patient's clinical data from the specific hospital. That is computerized patient record. Then electronic health care record. Third one is electronic health care. It contains all patients' health information. It contains all patients' health information. Then fourth one is personal health record. Third one is electronic health care record. It contains all patient health information. What is personal health information? Health information, medical history, symptoms, diagnosis, procedure and outcome, lab result, X-ray and demographic variables. Then personal health records. Personal health records contains about the patient history, then computerized medical record. These types of documents are created by image scanning, by paper based health record. Computerized medical record means the documents are created by image scanning. Then digital medical record. Digital medical records are the digital version of all the information. It is the digital medical record. That is web-based record maintained by the healthcare provider. Then clinical data repository. Clinical data repository means data stored and manage the clinical data collected from the different health service providers. That is the clinical data repository. Operational data